Hi, and welcome to today's podcast. I'm Glenn Pearson, author of Thriving in the Healthcare Market, Strategies from an Industry Insider for Selling Your Product. And my book includes 84 pitfalls that vendors often fall into as they sell products into hospitals and healthcare services. This podcast is being sponsored by ACO Exhibit Hall. And today I'm going to be talking with Mike DeCastro, who's the National Sales Director for Topcon Healthcare. And what they are is a comprehensive ophthalmic device manufacturer, and they provide point-of-care diabetes eye exams, which is obviously a very important need for people in that population group. So welcome, Mike, and I'd like to just ask you a couple of questions. First of all, what is the most significant thing that your company does for ACOs?
Thanks, Glenn. I appreciate you having me on the podcast. And well, what we find is that for providers, ACOs, and health plans, the diabetes eye exam is one of the most difficult quality measures to close. So patients with diabetes are typically receiving most of their comprehensive diabetes care measures addressed during a wellness visit with their PCP. This includes the A1Cs, kidney monitoring, and a foot exam. However, they're typically referred out to a specialist to obtain the diabetes eye exam. This creates a large disparity in compliance, as referring out now introduces significant barriers for that patient, including transportation, additional co-pays, and during the pandemic, added exposure in having to attend another doctor's appointment. And what we find is that studies show that about 20% of diabetic patients with type 2 will already have some form of retinopathy at the time of their diagnosis. If left undiagnosed, retinopathy can eventually become vision threatening and increasingly expensive to treat, from several $100s per month in injections to several thousand if laser or surgical intervention is required. So point of care testing for diabetic retinopathy enables early detection. It enables the ACO to put a treatment plan around that patient when pathology is detected, and can also impact RAF scores by automating the clinical documentation necessary to code that patient to the highest level of specificity.
Cool. Well, it sounds like you have some great services there, very much focusing in on something that sounds like is neglected sometimes. As you know, providers have lots of choices and ACOs have lots of choices. Why should they work with Topcon instead of some other companies?
Definitely, good question. Well, what we find is the most common barrier to implementing any new technology in a practice setting are upfront costs and the provider's uncertainty around the economics, right? So as a leading manufacturer of ophthalmic technology for over 50 years, Topcon has the flexibility to provide the equipment without any upfront capital costs or long-term commitments. We then partner with that provider's practice to initiate a pilot program where we aim to embed this technology, this 1 to 2 minute test, into their daily workflow, and then support them with reimbursement guidance. And our shared objective with that practice is making the program financially and operationally successful.
Wow, there's a lot of information. I've learned a lot just in these couple minutes talking to you. So I want to thank our audience for tuning in, and I encourage you in the audience to go to the ACOExhibithall.com site and visit the Topcon booth there. They have lots of good information. I'm sure they'd be happy to answer any questions you have, a chance to interact with their staff, and just find out more about them. And let me put in a plug again for my book, that for those of you who are dealing directly with hospitals, physicians, healthcare organizations, this will really help you understand the lay of the land, avoid some of the 84 pitfalls that I've seen over my 30-year career as a healthcare executive trip up vendors. So hope you check that out as well. So thanks for tuning in, and check out previous podcasts and go to ACOExhibithall.com. See you next time.